ভূতের মতন দেখলাম, কি এটা বুঝলাম না।
শেয়ার তো দিচ্ছে স্ক্রিন দেখা যাচ্ছে না।
হ্যাঁ, দেখা যাচ্ছে।
Assalamu alaikum. My name is Nishadip Begim. Today I will discuss on disorders and tests for renal, hepatic, and cardiac functions. Introduction. Renal functions regulate fluid balance, electrolyte levels, and waste extractions. Disorders associated such as chronic kidney disease or acute kidney injury can be identified through markers like serum creatine, blood urea, nitrogen, and glomerular filtration rate, etc. Hepatic functions involves metabolism, detoxifications, and synthesis of vital proteins. Conditions like hepatitis, cirrhosis, and fatty liver disease require tests such as ALT, AST, alkaline phosphatase, and bilirubin and albumin for accurate assessment. Cardiac functions ensures oxygen delivery to tissue and regulation of blood pressures. Disorders such as ischemic heart disease, heart failure, and arrhythmias are monitored using electrocardiogram, troponin levels, echodiagraphy, and lipid profiling testing. Renal disorders. There are several renal disorders. Here, discuss on only four common renal disorders, such as chronic kidney disease, which is gradual loss of renal functions over a period of times of months to years, often processing through 5 stages until end stage renal disease requiring dialysis or transplantation. Acute kidney injury. Acute kidney injury refers to a rapid decline in glomerular filtration rate over hours to days, resulting in accumulation of nitrogenous wastes and fluid caused electrolyte imbalance. Nephrotic syndrome. Nephrotic syndrome is characterized by heavy proteinuria, hypoalbuminemia, albuminemia, hyperlipidemia, and generalized edema, reflecting a disruption of glomerular filtration barrier. Urinary tract infections. Urinary tract infections mainly caused by microbial invasion of the urinary tract, classified by locations, on the basis of locations such as cystitis on bladder, polionephritis in kidney, or other erythrocytes. Renal disorders. There are common symptoms of a renal dysfunctions. First of all, swelling or edema, fluid buildup in legs, ankles, feet, or face due to poor filtration, changes in urination, fatigue and weakness, nausea and vomiting, confusion or difficulty concentrating, persisting itching. Here the tests for kidney function, and there are several tests for kidney dysfunction, and they are on they are tabulated the test, the principal and the normal range of this each test. The tests such as serum creatine test, glomerular filtration rate, blood urea nitrogen, urinalysis of protein, glucose specific gravity, and microalbuminuria. Suggestion for kidney patients. Dietary modifications. Control protein intake, sodium restriction, potassium management, and fluid balance. Mitigation and nephrotoxin avoidance, lifestyle and physical activity. Require regular monitoring and preventive care, and psychosocial support and education. Hepatic disorders. There are also several hepatic disorders for hepatic dysfunctions, such as jaundice. It is a medical condition characterized by the yellowing of the skin, mucous membranes, and the white of the eyes due to elevated levels of bilirubin in the blood. And there are also three types of hepatitis, such as hepatitis A, hepatitis B, and hepatitis C. And a non-alcoholic fatty liver disease and alcoholic fatty liver disease also contain liver cancer. Common symptoms of hepatic dysfunction. First of all, jaundice and the yellowing of skin and eyes, dark dark color urine and pale stones, easy bruising and bleeding, fatigue and weakness, confusion or slurred speech, a loss of appetite and nausea, abdominal swelling and itchy skin. Here are the common tests for liver dysfunctions. First of all, ALT, which functional assessed to liver cell injury. AST, aspirated transaminase, which liver and muscles injury. And other also ALP, GGT, total bilirubin, direct bilirubin, albumin, total protein, and prothrombin time. Suggestion for liver. Dietary and nutritional guidance. They should take food which includes low fat. Balance means limits saturated fat and cholesterol. Reduce sugar intake, moderate protein, salt control, alcohol abstinence, etc. Medication and supplement considerations, lifestyle and behavior adjustment, maintain a healthy weight, engage in regular physical activity, quit smoking, practice safe hygiene. Cardiac disorders. Cardiac disorders also contain several types, such as coronary artery disease. It's caused by arteriosclerosis, which is a plaque build up in coronary arteries, reduce oxygen delivery to myocardium. Risk factors: high LDL cholesterol, hypertension, smoking, diabetes, and sedentary lifestyle. Heart failure, inability of heart to pump blood efficiently, arrhythmias, abnormal electric impulse in the heart includes arterial fibrillations, ventricular tachycardia, and bradycardia. Hypertension, elevated system blood pressure. It can be primary or secondary. Common symptoms of cardiac disorders. First of all, chest pain or discomfort, which called angina, and shortness of breath, palpitations, fatigue and weakness, swelling, dizziness, and lightheadedness, sudden weight gain. Here are the common test of heart dysfunctions. First of all, ejection fractions, which measures percentage of pump blood per heartbeat. Troponin,
হ্যালো,
brain net, natriuretic vapor, etc. Suggestions for heart patients: adopt a heart healthy diet, limit sodium intake, avoid trans fats, excess, etc. Lifestyle and activity also modified, and medication and monitoring need. Conclusion: dysfunction in kidney, liver, and heart can cause serious health problems. Early diagnosis helps to prevent diseases. Key tests such as creatinine level, liver enzymes, ECG, cardiac biomarkers, etc. Technology boosts are real-time biosensors and wearable monitors organs healthy health continuously. AI improves detections. AI reads can ECG and tissue samples more accurately. Personalized medicine grows. Genetics and protein data help customize treatment for each parts. Thank you.
তোমার যেটা মনে হয়েছে যে তুমি অনেকগুলো জিনিস পুরা পড়ে যাচ্ছ না, অল্প সময়ের মধ্যে হয়তো লেখা আছে 10 লাইন, 2-3 লাইন তৈরি নিচের দিকে যাচ্ছ না। এর কারণটা কি? সময় সংকট না অন্য কিছু?
স্যার স্লাইড একটু বড় তো স্যার, চাচ্ছিলাম স্কিপ করার জন্য, যদি সময় তো বেশি হয়ে যাচ্ছিল ভাই।
তো তাহলে স্লাইড আগে তো তুমি তৈরি করছো, তখনই তোমার চিন্তা করার দরকার ছিল। তুমি পরে প্র্যাকটিস করছো কখনো?
জি স্যার,